I look okay. I decided to go with the
Let me see.
quarantine look. No makeup, no nothing.
Ah, how do y'all do it though? I mean, so you guys are always behind the glass anyway for the most part. But
So
nowadays, how do y'all do it?
we just recently got the glass partitions up.
Hmm.
I want to say in the past like 2.5 weeks, we just got them up. It's not bad. It's just you still have space underneath, so
Hey,
you
my
can
sugar
slide.
mama just joined. Hey, sugar mommy.
Oh, hello everybody. So we just slip the prescriptions right underneath the glass
Yeah.
partition, or plexiglass partition. Everything is, you have to wear gloves, you have to wear masks. It's all required. We don't have to wear like the entire garb, because we're not seeing any sick patients. Houston's really good about staying inside. Anybody that does have COVID or that was tested positive
Hmm.
did self quarantine. Nobody was out and about, which is good. It reduces our risk of getting it and bringing it home to our families. So,
Yeah,
eh.
but in Houston, the numbers are going up.
So
This
the
is
numbers
some
may
confirmed case
be
now in the Harris County. I'm just gonna use Harris County because the largest county in Houston area, right? Is 5,827,
right, but we have
and
2.9 million people living in the city.
right.
Mhm.
But if you
So,
look at it from the Texas perspective, though, out of the whole of Texas, we have 27,054
and I
confirmed cases.
and I
Why are we even
think
talking about it? We're not even ready yet. We told people it's gonna start at 6 p.m. But we're already talking about it. We're already diving deep into it.
ooh, if you want, we can take a pause.
Let's just chill a little bit. People
That's
are
fine.
still joining. We have 3 viewers right now, so
How's everything going on with you? How's your family? How's your wife?
family's great. Wife is awesome. She's in here somewhere. We've
Yeah,
been home alone forever.
really. What
Yeah, my children are, since spring break, that's when we wouldn't resume because they asked us to stay home right after spring break because the children they were with my mother-in-law,
Mhm.
and so they stayed. We would just like y'all
Really?
stay over there since that's where y'all have been, so
Okay.
just enjoy. So we go every Sunday to visit with them and just hang out with them. Today I was just coming from over there actually,
For real?
and they need anything, we
Y'all
take
don't
it to
miss
them.
them? I would miss them.
No, we don't.
Ah! I aspire to be that level of tangibility and
uh,
presence. Like, oh yeah, no, if you're at your grandma's house, that's fine.
yeah.
That's okay. That's good.
When you've been with them too long, you won't miss them anymore. We don't.
I guess
We see
whenever they're
them though. We
brand
do video
new.
calls almost every day.
I'm sorry?
We do video calls almost every day.
Oh yeah, that's true. We have that technology, thank God.
I
If this was
know.
an age where we didn't have that, people would be running crazy or writing letters, one or the other. Which is something folks have taken up a hobby in doing while they've been in quarantine,
Right.
which is good. I mean, think about it. There's nothing more precious than having someone's handwriting, which is
Right.
a part of who they are. Some people nowadays, if your mother was to write a note, you probably wouldn't recognize her handwriting. Or let me say for the younger generation, they probably wouldn't recognize, their parents' handwriting unless
That's
it's a
true.
signature for a permission slip. But
Well, let's see what the future holds for these young folks. We can't tell because everything now is AI, right? So,
yeah,
hey, hey, Doc. Thanks for the session last week. I see Dr. Adeomi. Thanks so much. We still at it. That the information you supplied us was unique.
yeah.
To a large extent. We learned so much. We appreciate you, man. Like I told you the other day, uh, you should take a second job or a part-time job or something as an educator. It's very necessary. Antayo, I see you, and I need Dr. Derrida on here too because we need to talk about mental health sometimes next week. I'll have to talk to my wife's uncle to see if he can join us. Here, but today, well, it's 6 p.m. Central, 7 Eastern. So I'm here with Dr. Susan Adetokunbo Sude, a pharmacist, and she's a retail pharmacist. So here today we're going to be talking to her about having natural remedies for COVID-19, right? So
Correct.
with the death toll, on the rise now, it's and then no vaccine just yet. Maybe there are some that's still being tested, right?
Um,
Um,
there are definitely. Everybody is working overtime to
right.
either trying to be the person to discover the treatment, or
Well, we
some
heard
type
just
of
yesterday
different.
or 2 days ago that Madagascar came up with something and cured about two people or so, and the U.S. is trying to fund it and whatnot. So
But
we
don't
don't
they
know
only
just
have
yet.
two people that have the coronavirus anyways? So I think those individuals probably recovered. In my own professional opinion, I would call that snake oil. I wouldn't call that something that's necessarily real, because not enough study has
Has
been.
been done. Yeah.
Correct. You can't just base it off of two individuals. Those two individuals may be genetically related. Maybe that's why it works better with their body chemistry. What if you try it from somebody else from a different race or a different continent who has grown up in a completely different atmosphere and environment, and it doesn't work on them?
Mm.
You would have to take that into consideration, that factor into consideration.
Awesome. So,
And
Dr. Ade, wow, I never knew that. Well, I thought you would be anyway because the way you schooled us last week, man, was as if you've been, teaching classes on COVID-19 forever. Apparently, you were associate professor at WVU Ruby Memorial Hospital in Morgantown, West Virginia.
West Virginia,
Awesome.
good for
Awesome.
you.
That explains a whole lot, and I think you need to do more because you're saving lives and still educating people at the same time, and now preventative methods to do stuff. So, Doc, with the death toll on the rise and people that are the confirmed cases of this COVID-19, I took the toll that I got earlier from Google today says in Texas alone, we have a confirmed cases of coronavirus with 27,054 people with
Mm-hmm.
confirmed cases, out of which 11,170 of them recovered. However, we still have 732 people dead, right?
So
US at
that's
large, we have 1.06 million people with 123,000 recovered and 61,342 deaths.
now.
Globally, 3.17 million, 958,000 people recovered, 225 people are dead already.
Mm-hmm.
And Harris County being the largest county in the Houston area, housing, of course, with the Houston metro area houses about over a little over 2 million people,
Mm-hmm.
and of course the most diverse cities in the United States. Um, they already have 5,827 confirmed cases
Mm-hmm.
and 98 deaths since the
So
coronavirus. I
so
live in Harris County, and the fear is the zip code that the most hit were 77449, and I
mhm.
think 084. You can imagine that's close to home.
It is very close to home. But what we have to do is we have to keep in perspective how many people actually live in Harris County and how many people actually live in the entire state of Texas. Even though we have about 5,900 individuals who are confirmed to be positive and 98 that have passed away, um, we are a city that has over 2 million people in population and a state that has over 29 million. So if we're looking at 27,000 compared to 29 million, and then we're looking at New York, who has well over, I want to say 39 million,
Million. Mhm.
right, citizens living within the city on top of one another, mind you. We're in a state where we're more spread
It's
out.
spread. Yeah.
Exactly. And so the probability of someone in New York getting the coronavirus is incredibly high. Think about living in an apartment building and your doors are facing one another. And let's say this person has COVID and they cough and they've been sick. You don't think any of that is going to hit circulation or maybe even slip underneath the front door and spread through the hallway? Or as they're coming out the hallway coughing in the hallway, that someone is not going to get it unless they just never step out of their homes. And
More
here we
so,
live in
there's
Houston.
probably recirculation of the air they breathe anyway in the hallways and whatnot.
Exactly. Here we're more spread out. Our apartment complexes are, the doors face outside. Some of
Right.
them, yes, with the high rises, their doors are staggered or facing one another.
Hmm.
So those individuals might be more at risk. But the people that are at risk are the ones that are in nursing homes where they're being cared for, where one nurse is taking care of maybe 5 patients and she could
Right.
possibly spread it from one person to the next. So we have to take everything, every bit of information into account for the numbers. Yes, the numbers here in Texas are steadily rising, but they're not numbers, they're still numbers of concern, but not to the level of that of the state of New York and the city of New York City.
Mm.
You understand what I'm saying? So I think individuals here in Texas have been extremely good with following instructions,
I
watching the
kudos
local
to
news.
Houstonians. I mean, that's something. The moment, and this again goes to the mayor, right? I would always salute that man. I remember during is it Hurricane Harvey?
Mhm.
I mean, he was able to contain this in a matter of days, and was able to get us going, get the economy rolling,
Got you.
which is a lot of concern for most leaders right now.
Right.
However, life matters, right?
It does.
And we as Africans, we mostly depend on, should I say mostly, but we sure depend on other remedies as opposed to what you, the pharmacist, will recommend for us, right? Or even we do a lot of self-medication anyway,
True.
right?
True.
And
A lot of
and
people
I
do.
remember you came to the studio. Do you want to say something about that quickly?
Sure.
About self-medicating before we go into the natural remedies for COVID-19.
Mm. So I have an issue with self-medication because you have not seen a professional that has legitimately ascribed onto you that this is what you're suffering from, this ailment, this
Mm,
particular disease. And so when you automatically think in your mind or confirm that, oh, I have this illness, this is what I need to do, you can quite instantly hurt yourself. Just like the individuals who got hold of or wind of hydroxychloroquine and chloroquine as potential treatments for COVID, and then started overdosing and destroying their livers and destroying their kidneys and essentially have an organ breakdown. You never want to do that. You want to make sure that the information that you receive is evidence based. And on top of that, you want to make sure that you consult someone who actually went through 12 years of becoming a medical doctor,
I know,
from
right?
beginning to end, and has a little bit of sprinkle of street cred on top of it. So
You know,
never do it yourself.
this should give y'all like the African doctors in the United States, the African pharmacists in the United States. This should give y'all, I believe, should give y'all an edge above any, because you understand the natural remedies than most, because that's what we administer anyway. First off, we do a lot of that.
We
Then,
use a
secondly,
lot of
then you are
medications.
educated to be able to prescribe what's medically tested and proven to
Mhm.
work for people, right?
So then
So,
let's jump into the natural remedies
right.
concerning COVID. And I'm going to be quite frank and honest. There are none.
It's not,
This is
it
a
is
new.
necessary. It is necessary. We need it right now because, I mean, a lot of
I
us are afraid.
I understand that we need it, but this is a fairly new virus. Everyone, that is anyone, is scrambling to try to figure out a treatment or a vaccine. So you can't tell me that someone knows a remedy now. This is new.
Mm,
Do you understand? So, and I know that this may be discouraging. Don't get me wrong. Using herbs isn't just a novel idea. This has been around for millennia, for thousands of years. Herbs like licorice, like ginger, like turmeric, all of those have been used for respiratory infections, pneumonia,
One second,
flu, things like
Doc.
that. Mhm.
Some people said they can't see my face. It could be their phone. Can you see my face?
I can see your face, like from your eyebrows down.
Oh, really? I need to
Yes,
move back a little.
yes. Now I can see
Much better?
a whole lot better. I can see the entirety of you.
Okay, maybe that's what he meant. Because
I,
I thought it was blurry or dark or something.
no,
Okay.
no, 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 no,
All
no.
right, cool.
Just eyebrow down.
Yeah, I
But
need to showcase my Afrocentric teas, man. But
yes,
anyway,
show it all.
please, let's hear from you, please, about these remedies, natural remedies that you're talking about.
Okay, so there was one. Um, Coronavirus is somewhat or a derivative of the SARS that came out in 2003. And they did find a remedy, an herb. It's forsythia. And they found that it was somewhat effective in laboratory studies, but they're not really showing any promise right now with COVID. Understandable. Again, it's a new virus, that has been with animals for years upon years, as far as we know. And this is the first time it's ever been transmitted from an animal to a human being. So we don't know what we're doing. Let's be real. Let's let people know everybody is experimenting and trying to find out how to solve this puzzle. You have health experts that warn that we don't have enough data to support the use of herbal remedies concerning COVID. One of the biggest problems that's here in the United States is that many of the herbal or the natural remedies are of low quality in the first place. So they may tell you that, echinacea, it has 50 milligrams of echinacea. Well, because they're not really regulated by the FDA, that may not necessarily be true.
Mm,
They might only have 20 milligrams or 10 milligrams in echinacea. So they can lie on their labels just to make a buck. You understand what I'm saying? So the biggest thing in our community that we can do right now is to continue to wash our hands. Wear masks while going out. There is a mandate in Harris County with a
right.
$1,000 fine that if you're going to go out in a public place, you need to be
You
wearing
have to wear
a
your
mask.
mask. Yeah.
It decreases the probability to 1.5% if two people are wearing masks, then compared to 70% if only one person is wearing the
Again.
mask. That's a huge jump, 70 to 1.5%. So it is beneficial for you to wear a mask of some sort. I don't care if you make it out of a handkerchief. I don't care if you make it out of a bandana or a
Bandana.
t-shirt.
Yeah. Like the one I had
There are
last week.
plenty
Yeah.
of videos on YouTube that show you how to make masks with the hair ties and, something to cover your face. Um, for individuals who are 10 and older. Let's reiterate that. I know some people are trying to put masks on their little babies. They may stay on, they may not stay on. The best bet is just to keep them in the house away from the public. And what I really wanted us to do in order to protect our community is to talk about self-care at this point. I understand we self-medicate, but self-care is going to be way more important. So if you're feeling sick, please rest. Drink plenty of fluids. There is turmeric tea, ginger tea, that has been circulating around in the atmosphere. But honestly, when you're doing tea, when you're, dipping the tea bag, you're just essentially drinking flavored water, which is good. It's still vital for the body. You're sweating, you're overheating, you have chills. The worst thing that, we want to happen to you is dehydration, because that will put you in the hospital. And then that increases your risk of maybe getting even sicker. So keep that in mind. Eating nutritious foods. Number one important thing you can do. Citrus, vitamin C, grapefruits, lemons, oranges. Get as many of those as you can inside your body. Broccoli, spinach, your greens, green beans,
Are there
yogurt.
limits to these though? Are there limits to how much of these you can take?
So the thing about the body and nutrition, vitamins, minerals, it will use as much as it wants to and then dispose of the rest. So essentially, you can really never overdose on certain vitamins, but your body will just use what it wants and then expels the rest, either in your urine or in your feces. So bell peppers, almonds, I would encourage people to look up some nutritious foods that help to boost your immune system, so that you're able to fight this off if you encounter it. Make sure you have Tylenol in your cupboards. Um,
Why
Make
is that?
sure because it's a fever reducer. So the issue with some patients is their fever is not under control, which if it's not, it can do serious brain damage, which is what we don't want to happen. So keeping your fever low. If your fever is over 101, please call your physician. Most
So I
likely
have
they
a
will.
question. Why Tylenol? Why not Advil or Ali?
So some of the information that the NIH has received is that Advil or any of the NSAIDs could possibly worsen COVID if you are positive for it. So
If you
everyone
want.
is suggesting to go strictly to Tylenol. They've noticed no adverse issues with Tylenol. Um, Please feel free again to look up any foods, any remedies um, online, mainly fresh fruits and vegetables to help
Fresh,
with your immune system.
uncooked.
Mhm. It can be cooked or uncooked. It depends on you. Some people, they want to add a little seasoning to their broccoli, put a little
Right.
cheese on it. That's fine. As long as you get it into your system so that your body can break it down appropriately and use it to your benefit.
So those I believe are pre-COVID-19
Hmm.
before you get infected.
Hmm.
What to do when you are or if you are infected?
You want to make sure that you stay in a separate room from other family members. You want to use a dedicated bathroom if possible, and they may not be possible. A lot of hotels and places are, shutting down. They don't want people in their, hotels, motels,
Right.
who are ill. So if you possibly can, stay within your room, stay in a designated area where you have the use of a bathroom. Make sure to clean and disinfect all surfaces. You want to make sure you seek medical attention if you have a fever, a cough, difficulty breathing, you've lost your sense of smell or taste, you have a sore throat, which is impeding you from eating or drinking. It's a painful situation. And all of these things have to be consistent.
Hmm.
They have to be going on within a 7-day time period or a 14-day time period. If you just have it for one day, there may be a probability that you don't have COVID, but if you still want to get tested, that's fine. It may be due to allergies. Um, because of the pollen that is coming into the city, because spring is coming, some
Hmm.
people are losing their taste of smell and their taste or their sense of smell and their sense of taste. Excuse me. So if that is an issue for you, but you don't see fever or cough or any type of difficulty breathing, then most likely it is allergies, but I would still implore you to seek medical attention, just to make sure that you are not infected with COVID.
Well, talking about seeking medical attention, right? If even if you call the hospital right now, or if you're trying to see if you want to schedule an appointment or whatnot to go in,
Mhm.
they tell you they can't see you up until maybe end of May, and
Now, some. Mhm.
you
Go ahead.
wonder why, what's going on. Maybe it's going to be softened starting next week because of the leaks to
Mhm.
start next, and but
Mhm.
prior to they won't see you. Doesn't
Um,
that have an adverse effect on people that are supposed to be vaccinated, probably for their annual vaccines or whatever? You know, doesn't that pose a threat to them?
it does not, because healthcare professionals still need to be healthy in order to take care of you. And so they want to make sure that their facilities are clean and free of COVID. Now, what a lot of doctors have been doing is teledoc,
Right.
teleconferencing, seeing patients just like how we're talking right now.
Yeah.
They may not be able to touch you or palpitate certain regions or take a stethoscope and listen to you, breathe and what's going on with your chest. So it makes their job a little bit difficult to try to diagnose you with what you may be going through. But either way, what everybody's experiencing right now may be certain respiratory issues due to the pollen count that's going on right now. So doctors with the little resources that they do have,
Mhm.
they have to try to figure out how to treat their patients without being able to see them face to face. So far, it's been working well for them, but I know a lot of them are eager to have patients come in. They are eager for the foot traffic because they do feel a certain, they feel as if they're not doing their job as effectively because they cannot physically touch their patients. And I know it's also a sad situation in New York where some individuals, as physicians, have to garb up in order to actually touch their patients,
Mhm.
make them comfortable, help them with the things that they need. So it's difficult, but it's temporary.
Are pharmacists able to see people now? Like, people have walk-ins to pharmacies,
Mm-hmm.
and when they do, there's this wing for consultation and then this wing for pickup.
Mm-hmm.
Are pharmacists able to are people able to consult the pharmacist now if they can't even go to the hospital?
Correct. They absolutely are able to. A lot of pharmacies have put in place plexiglasses to keep themselves safe,
Safe, yeah.
um, but still be able to advise patients on what they need to do with whatever is going on with their body at that particular time. So patients are free to come to the pharmacy to ask for assistance. Please do keep in mind, as pharmacists, we cannot prescribe medication. The only thing that we can do is advise you on what to take that is over the counter. If you are COVID positive, I would implore you not to come to the pharmacy, to stay at home. We also have telephones. You can call us and ask us questions too.
But what if you don't know? So if I come now, let's say I'm feeling somehow by myself, and naturally the symptoms for fever and COVID are similar somehow, right? However, if I don't know, let's say as an African, I do not understand the difference between COVID and my symptoms for fever or whatnot,
Mhm.
and I want to be able to get that advice as to what is wrong with me? Do
Mhm.
I need to go for testing? This is the way I'm feeling. Can you tell us the difference between the symptoms for COVID-19 and
Mhm.
the symptoms for the regular allergies or, fever?
Okay, so allergies don't have fever. They may have a trickling cough. They may have a slight sore throat, but all of these things go away within 2 to 3 days. Sometimes they may last 7 days or more. But if you do not have fever or difficulty breathing, or a nagging, dry cough, then you should be okay. Those are the things to really look for when you have COVID-19: a high fever, a nagging dry cough with accompanied with sore throat and difficulty breathing. And when I mean difficulty breathing, I mean you're getting up from your bed and you're walking to the door of your bedroom and you feel as if you're not intaking enough air and you're suffocating. That would be one of the signs. Also, body ache, malaise. It's worse than the flu. You actually feel like your body is breaking down.
Mm.
So you would definitely know the difference between having allergies and having COVID. Just a simple task of maybe going downstairs to make yourself a bowl of cereal will feel impossible to you.
So we have 5 minutes to round up, and I just wanted to emphasize on. I know you talked about it earlier. I wanted to lay emphasis on the kind of food one can eat.
Mhm.
Talking about the natural remedies, right? The kind of food one can eat, the kind of fruits
Mhm.
one can take,
Mhm.
and if any medication one needs to have in your medicine cabinet. and also maybe a form of exercise and what one needs to do to stay safe and
Gotcha.
be, prevent oneself from, contracting this COVID-19 if you do not already have.
Gotcha. So plenty of rest, like I said before, drinking lots of fluids, water, juice, tea, eating citrusy fruits, green vegetables, yogurt, bell peppers, almonds. These all promote healthy immune systems. You want to make sure while you're at home that you're eating a healthy diet, you're sleeping, that you're staying active. You can still walk around your neighborhoods. You can walk around your parks. You just cannot play at the playground. Anywhere where there is an area for congregation, you cannot go. But you can walk on the trails. You can walk on the sidewalks. You can ride your bicycles. There are workout videos on YouTube if you are unable to go to the gym. There are
Right.
plenty of workout individuals on Instagram that have now kind of bursted into light on IGTV. So follow up with them. Also, making social contact with loved ones through the phone, through the internet. This can also combat some of the loneliness and depression some individuals might be
Oh,
feeling.
tell me
We
about that.
also have to think about our mental health.
Mm,
Keep in mind, children need a lot of extra love and attention during this time from adults. Make sure you have them on a regular routine and schedule as much as possible. Listen to them. Let them talk and express their feelings. Let them cry it out. It's okay. Don't get frustrated with them. They don't quite understand what's going on. It is normal to feel sad. It's normal to feel stressed and confused during this time of crisis. Talking to people that you can trust, that are your friends and your family members. And if you really feel overwhelmed, I would suggest you speak to a medical professional, a psychiatrist, a psychologist, someone that you can vent to. And those individuals are also available via teledoc or any type of video chatting service.
fantastic. So, um, if you have any questions, guys, if you're watching us now and you have questions, you're more than welcome to type it out. And I just want to say a big thank you to you. I'll read it to her, of course, and she can see it too. We can address that quickly if you have any questions. I know we still have about 2 or 3 more minutes.
Yes,
Um,
please.
Thanks to Dr. Ade. I know you talked about earlier, Dr. Susan. You talked about that you can walk around your neighborhood. There was this time they said even they are going to shut down the parks and everything. So
Mhm.
what I did was I took to my treadmill in the garage and I started using it. It's been there
Yeah.
for over 10 years or thereabout. I just, I stopped using it. So I took to it. I naturally go to the park, right? So,
Hmm.
but when Dr. Ade mentioned that we can actually, that the droplets are heavy and they don't stay in the air as
Hmm.
long as we thought they stayed in the air. So I was able to, on Saturday, I was able to go out with my brother. We went jogging outside. I was supposed to, just getting on the treadmill.
So
Um,
we have Clara,
yeah,
214
I'm just looking at the question now.
So
What did she mean by drinking tea is just mere fluid?
anything fluid, water, Gatorade, Powerade. The only reason why I say tea is because our elderly parents, they love to drink tea. At least my
That's
mom
true.
does.
That is
I,
very
I I enjoy buying her new boxes of tea, like, ooh, look what I found, hibiscus tea, or here's ginger tea, or here's turmeric tea. That's her thing. And so the fact that you're using water to, put a tea bag in, you're still drinking fluids. It's flavored water, in my opinion.
true.
It's just an opinion.
Right. And also the vitamins. I know Dr. Bukola Martin, that was last Friday, or thereabout, she schooled us on, the supplements that we need to take. And if you want to emphasize on that a little bit more.
So I'm gonna address Clara again. She says, "Are you saying the
The ginger,
ginger,
lemon,
lemon,
and
and
turmeric
turmeric
work.
won't work if you have COVID symptoms?" What I'm saying is there's not enough studies to prove that it does work against COVID symptoms. Again, this is a brand new virus. Nobody knows anything. All right, they're all trying to figure it out all at the same time. We're all taking the test, and nobody has studied for it. So, I was trying to explain healthy foods to keep your immune system up, making sure that you eat well, you sleep well, that you stay active. Those are the main things that you can do to combat COVID, by making sure you take care of yourself physically and mentally.
Thank you. Thank you.
Mhm.
So now let's talk about the supplements, the vitamins.
Mhm. So vitamins that you want to make sure you have on deck, multivitamins. That's for your overall health. Citric acid, vitamin C, what else? Vitamin A, all the vitamin B's, 12, 1, 6, everything. Those will give you energy. Um, yeah, that's pretty much it. You just need all around multivitamin to take every single day. That has iron, that has magnesium, that has manganese, that has everything in it, just so that you can be the best individual that you can be.
Fantastic.
Mhm.
Thank you so very much. I'm
You're
sure we're still going to have
welcome.
to in the studio once we are able to move around and we're able to do things properly. We'll have you in the studio then. But I just want to say a huge thank you to you today for joining us and for schooling us. You guys are doing an excellent job. All doctors, all frontliners. Either you're a cleaner, you deliver mail, whatever it is, we just want to salute you guys.
Yeah.
I can't emphasize
Thank you.
that enough. You guys are saving lives every day, and the doctors, the nurses that are right there in the room with these people. I don't know how to do it. I can imagine if my wife is a doctor or a nurse and she have to come back home after treating uh, COVID-19 patient. You love this person, but then she has to do the job. She has to save life. That's what she signed up for.
Oh
And
yeah.
then she comes back, you're thinking, oh, can I hug her? Can I not? I know they take necessary precautions
Oh, they do.
before going in, and even when they're leaving. However, the fear of
Mhm.
the virus itself is what is in us, and then you keep thinking, oh, should I not? Life is not as normal as it used to be. you
Yeah.
know. But that's why we just want to appreciate all front line workers,
Yeah.
be you a doctor, a nurse, a pharmacist, or a cleaner, a
A
male
janitor.
person.
Imagine them having to clean down and
I
just
mean,
sanitize everything.
those
I salute
guys,
our janitors. They have a
if
lot of work to do.
the
They're the
cleaners,
ones that are.
even at the grocery stores,
Hmm.
they dedicated some people out there to just spray down and wipe it down for you before you take the carts and all.
Yeah.
Everybody's just trying to be safe, and
Yeah.
we appreciate you all.